Hello world. On this session, I'm going to be talking just briefly, or that's the plan, to be brief on this one, about the healthcare in America. And although healthcare is a good thing, the insurance that's taking care of it, it really does need a lot of serious improvements. Um, I mean, I know that when I go to the doctor, and right now I'm fortunate to be one of those ones that does have health insurance. But at the same time, there's so many pre-existing conditions when you're changing employers, when you're changing doctors, and the pricing for just healthcare service is absolutely ridiculous. It is just insane. And I mean, when you're sick, you have to go, and then you get this huge, huge bill, and it's like, and then they expect you to pay it all at the end of the month. And that situation happened to me a few months ago. Uh, I was having some serious, serious headaches. That I had some internal bleeding in my head, and it's like I went to check it out, and I went and got a CT scan of my head, and and I went to the doctor to go through and to find out what was wrong and everything. They couldn't tell me what was wrong. Uh, Fortunately, the CT scan did not show any kind of hemorrhaging in the head. And a month or two later, I got my bill, and it's around $1,000 for just a head scan, not an entire body or a heart or anything, just the head, like a 3-minute scan, $1,000. And my bill was to pay the balance at the end of the month, and my insurance, you know, didn't cover it. And I explicitly called them before I went to the doctor to ask them, if this was going to be covered or not. And I asked them, if there is reason to believe, or if there is reason to believe the diagnostics that it might be a condition, not just going through and, yeah, I'm just going to get a head scan just for the hell of it. They told me that it would be covered. And I talked to the doctor about that, and they said that usually if they have reason to believe that it's some kind of medical concern, typically the insurance carriers will cover it. No, not the case. So that left me with that, and I called up the hospital to say, hey, you people are not getting this $1,000 worth by the end of the month. No way, no how, not with this economy, no way in hell. So, it's like you're going to have to work out some kind of payment plan or something, or you're not getting your money. So now I have that payment stretched over 9 months to pay that off along with the rest of my bills. And then I also received a doctor's bill for the visit, the consultation fees. And then I received a third bill from the radiologist who was reading the CT scan. And I'm thinking to myself, do I have to pay the janitor that sweeps and cleans the office of the radiologist? I mean, it's like, geez, who the hell else do I have to pay here? And it's like, it's absolutely ridiculous. So, but at the same time, compare it to, a lot of more unfortunate people in the world who can't go to the doctor and who don't have health care. And when they need to have, these types of services and stuff, it bankrupts them. It's just a mess. And at the same time, it's a complicated issue. but I know that we do need change in this nation. A lot of fundamental changes for a lot of things. So that's me giving my 2 cents on healthcare and sharing a bit of personal experience on that issue as well. Thanks.